Hey guys, here we go. Let's see. We're going into waiting for Jacob to come here. Once Jacob joins, we'll get going. There you go.
Hey,
Hi.
Jonathan.
How you
Hey,
doing,
how's it
Jacob?
going? Good. How are you?
Not bad. End of the
Yeah?
day.
Yeah,
Yeah.
nice.
Same thing
How's
with
the
the
day
day.
been?
It's been good. It's been a pretty calm day. Not too
Nice.
busy. Busy in the
Nice.
morning. Had a nice big gap in the middle of the day, and now I'm here.
Cool.
Spending time with you.
Nice.
Yeah, exactly.
Yeah.
And I had enough time in the middle of the day to walk the dog before it got really dark. So
Right, yeah.
you don't want to do that
Yeah.
here. How about over there? How's it going?
Pretty good. I had a pretty full day of telehealth patients and also had to try to walk my dog before it got dark. And, I feel like it gets dark at like 5 o'clock here. So, gotta get it done early. But yeah, but it's been a pretty good day. So, but
That's
I'm
good.
excited to be here and talk with you.
I know this is exciting. I'm actually
Yeah.
looking forward a lot to this.
Yeah.
A lot of good stuff, a lot of cool things that I'm sure you know all these things, and I really can't wait to like pick at it and hear you talk about all this stuff. From what you
Awesome.
were telling me, I was like, oh my god, yes, I want to hear more about this. Tell me more. Um,
Yeah.
so I guess from the beginning, I mean, Jacob, why don't you tell me a little bit? You work at UT.
Yes. So I work at UT Southwestern, which is a hospital system here in Dallas, and we've got a clinical voice center, and it's me and four other speech pathologists and three laryngologists.
Oh my god,
So it's a pretty great setup.
that's a pretty big. That's on and it's
Yeah.
UT, which is pretty nice.
Yeah. Uh-huh.
So what do you exactly do you? I guess what do you guys do together? Or what do you most likely end up working with? Because you work with a lot of different people, but specifically performers wise,
Yeah.
what do
So
you do with them?
okay, yeah. So we see, like you said, a wide variety of people, but we see a lot of singers. All of our SLPs and two of our laryngologists are all, singers, have a singing background, so it's something we're all pretty passionate about. So in non-COVID times, we typically have a very, multidisciplinary type setup where a patient might come in and see the laryngologist and the SLP at the same time and all that. But right now, it's kind of like the laryngologists are doing all the initial kind of evaluation and then referring to SLPs, and we're either doing mostly telehealth. In some circumstances, we've been doing like in-person stuff, but mainly in regards to performers, we tend to either see people for um, just kind of wellness checkups, what we call it, like just if singers want to come in and they may not be having problems, but they just want to get a look at their vocal folds and get a look at their instrument and stuff like that. We'll scope them, but most of the time we end up working with performers who are struggling in some capacity with their voice. So typically they see the laryngologist and we find out what's going on. And most of the time it involves some form of voice therapy, which is where I come in or one of my colleagues comes in. So, yeah.
So that's so you get I'm sure you've seen pretty much a good variety.
Yeah, good variety. Yes. Um, I would say we see, I mean, a big chunk of our population really is singers because I think that that's something that we've done a relatively good job at marketing to in our area here, singers. But we also see, like people who've had thyroid surgery or some sort of surgery and they ended up with a vocal fold paralysis, or we see people who've had they've been intubated for whatever
Yeah.
reason and have had vocal fold injuries. And we also work with like transgender individuals who are wanting to modify their voice. So a very wide variety of patient population, which I appreciate. I really like
Yeah,
that.
that's super interesting. Also, the whole like, idea of transgender. So, do you? I mean, well, I think we'll talk a little about the transgender thing, but I find that super intriguing in terms of like playing with the voice and how that starts to manifest. I guess as you change and as your body changes, and
Hmm.
I think that also falls a lot into how your body. It's this
Yeah.
tool that will manipulate your voice, right? How you
Yeah.
treat it, how you deal with it. But
hmm
I guess on the like average speaking for
hmm
the people, people that you see, the performers that you see, singers that you see, what are some of like the, I guess the easy, not the easiest, but the most common thing you start to see?
Yeah, so I would say the most common thing, honestly, is probably muscle tension dysphonia, which is basically the medical term for a voice disorder that's basically caused by muscle tension.
Mm,
So you can have primary muscle tension dysphonia, which means their vocal folds are healthy and there's no lesions or anything like that. They just have muscular imbalance within their larynx and usually somewhere else in their body that is making it where they can't produce effective voice. And with some of the singers that we see, they can have MTD that affects their speaking and some that affects just their singing, some that affects both. But we also see a decent amount of singers who have some sort of phonotraumatic lesion like a polyp or nodules or something like that with kind of overlaid muscle tension, kind of like,
yeah,
secondary compensatory stuff. But I think, I mean, honestly, I would say polyps and NTD are probably the most common things that we tend to see in performers, at least
how
in
do you
our
I guess
clinic.
how do you mitigate some of that? Do you have to go in and you have to go in and actually physically work some of those muscles or like take some tabs?
Yeah. Yeah. It kind of, I mean, right now with COVID, it's a little bit different. I have barely done any laryngeal massage or things like that typically I would do pretty much every day. But yeah, so if a patient comes and they have MTD, muscle tension dysphonia, we do work a lot on releasing that muscle tension. So through stretches, massage, and teaching them how to do stretches and massage, which I think is starting to become more, you know, mainstream. Like singers know, like, oh, I've got to, stretch my neck and stay loose and stuff
Yeah.
like that. But have you ever had a laryngeal massage
I've
before?
never had a lunge myself, but that sounds quite incredible. And I would
It's
love to
pretty, yeah, it's
have one.
pretty interesting. The first time I ever had it done, it actually kind of hurt a little bit because I had some muscle tension going on. But you'd be surprised how there's little spots up in there that when you get to, there's spots that oftentimes just aren't really, they don't get a whole lot of physical
Yeah.
attention. But releasing those areas can really help with getting a little bit more balance back into the muscles around your larynx. So I would say a lot of the you know people that we see, by the time they come to the clinic, like they're usually really struggling with muscle tension, so they have quite a bit.
Yeah.
And it's kind of like their larynx is just glued in their neck and like not mobile at all. So we spend a lot of time doing circumlaryngeal massage and stuff like that. But I've found, and this is what I was telling you about when we were messaging on
Yeah.
Instagram. I found that for most singers that are having these types of issues, usually it's not like the tension just all of a sudden manifests in their larynx for no reason. A lot of times it's because there's something going on further down the chain of their body that's causing some compensation
Yeah.
with what's going on in their larynx. So that has been kind of a learning thing for me because we just don't get a whole lot of training on that.
Yeah.
The rest of the body in speech pathology school. So following accounts like yours and a couple others has really helped me like recognize and understand how certain parts of fitness and what's going on with your body can impact your voice too.
That's
So,
I mean, I know I really wanted to get to that. But
yeah.
before that, I wanted to kind of see just a little bit more on your point of view and like what do you think some of that thing starts to happen? I guess you talk about like you got a lot of people that you would have to intervene with physical soft tissue work and then
hmm
also some of that opening it up caused by tension.
hmm
And then I mean I think about it like just think about singers and a lot of what they do revolves around shrugging or like creating this like tension. And even I can even relate that even to like fitness in some way. And we're probably gonna
hmm
allude to that in a little bit.
Yeah.
But I was I guess just kind of wondering what you thought were some of the things that create some or that start kind of like developing this tension within
Yeah.
singers, with the tension on your neck, the tension on the throat, and the tension on the upper neck. I believe you mentioned upper back,
Yeah. That's a good
upper back, and
question.
neck. There you go.
Yeah, yeah, that's a good question, and that's something that usually, at some point, that question is asked by the person I'm working with. Like, well, where did this tension come from?
Mm-hmm.
And it can be a variety of things, but I think the things that I tend to look out for and try to talk with people about is there's how you use your body when you sing, and then there's how you use your body the rest of the day, like the rest of your life, right?
Well said. Yeah.
So a lot of singers that we work with a lot of professional singers who it's like their full-time thing, but we also work with a lot of singers who are, they work a desk job from 9 to 5 and they're
Yeah.
sitting constantly. And I think, most people know about how sitting is not great for our bodies, but I think that and the change it has on a person's posture is a really one of those things that's overlooked. And like it's kind of a gradual change to
Yeah.
where you don't necessarily notice something right off the bat, but after years of just kind of sitting and your posture changing, it can really affect your voice. I think stress too really impacts thing or impacts tension mainly because of how that stress changes your breathing, right? Like if
Mm.
you're constantly stressed or something like that, there tends to be more high clavicular breathing patterns and less efficient, like abdominal type of breathing patterns, which again over time leads to tension. Um, and sometimes it can be like, injuries or, like if, you know, let's say maybe a few months prior to their voice kind of messing up on them, maybe they injure their knee somehow, like, tore their ACL or something like that. And then just over time with compensating for what's going on with their knee, they've kind of adopted
A
some,
different movement.
yeah, different kind of gait patterns. That's again just kind of led to imbalance in the upper body. So, and sometimes it can be related to, yeah, I think that is one of those things that gets overlooked though.
Yeah.
But sometimes it can also be related to like vocal technique as well, like, with speaking or singing, like if you just tend to have a lot of subglottal pressure or pressure underneath your vocal folds and squeezing in your throat when you sing, then,
Mhm.
that can also lead to some of that tightness too. But
That's nuts. I mean, those things that you kind of just alluded to, like posture, breathing, injuries,
mm-hmm,
all that is just kind of resonating. And I think a lot of times that I
mm-hmm,
find when I'm working with people, is that, or what I like to kind of talk to them is almost like the lack of registration of how these three or this couple things really
yeah,
affect in the voice, and they see it as like, oh, my voice, I just go vocal coach, my
right,
voice lessons, all the things, and then if I stay kind of back, they'll be
mm-hmm,
fine. But there is still, I think, a lack of understanding or lack of exposure of how, yeah, there are these inherent activities that your body starts to do because you're
mm-hmm,
singing naturally, because you're forced to try to find certain tensions in your body as you sing and as you get
right,
yourself to kind of reach those high notes or those lower notes, or
yeah,
depending on what you're trying to find in your body, that you
mm-hmm,
do create certain things and like postures and
mm-hmm,
certain like
yeah,
like the certain tightness and the certain like ways of achieving that tension that
yeah,
whether you go into like when you go into performance it might work, but then if you stay there after singing,
yeah,
after performing,
exactly,
it becomes this all the time,
right,
which is not healthy, which is not in the health, which is not the one that's going to let you kind of continuously be able to kind of swing back
right,
and forth in this pendulum like idea of like you sing for performance and then you breathe and you move and you move in your
exactly,
life.
yeah, yeah,
That's so cool. Yeah, that's like, I mean, that's really like, I think, and I think that's kind of where a lot of, I mean, I know myself and a couple other people that are working in this are looking to be able to see if kind of the industry can start to move more towards that, right? Um,
yeah. And I think that's really important, honestly, because like I said, in speech pathology school, we get a lot of training about the anatomy here, and of course, we learn about like the respiratory anatomy and whatnot, but it's not super in depth. And then there are speech pathologists who have really gone in depth and like learned more about that and have really helped advance our field to advance our field, and voice teachers and people that really understand how the body works. But I think there's still like you said, kind of a lack of, I guess, understanding of the link between the state of your body overall can significantly impact your voice.
Right.
So yeah, I think that's something that even with like a lot of the patients I see, there's just kind of that disconnect of like, okay, but my voice is my voice.
Yeah.
Why does it matter if my posture is out of whack or whatever? And it's like, well, I mean, your voice comes from your body. Like it's a result of coordinations of movement in your body. So it's really important.
That, and then I think it's also like I mean, because I think there's also this a little bit of a negative connotation falling under like when you talk about the body, especially when it comes to performers and artists in that general, is that it's a very thin line where you start talking about the body and it becomes this like, what do you mean like, do I need to like look this certain way in order
Right.
to think? How come? When in reality, I think there's also that fine line that you want to make sure that you address how the body functions rather than like how it looks. So you can still have the shape that you have, the body that you have, and still be able to function well, move well, be strong enough, and still have the ability to reach the appropriate positions in your body and work, I guess,
100%.
Work the right parts of your body so that you're able to perform and you're able to work your voice, your notes, all this stuff the way you want to work it, not necessarily chasing the aesthetic side, which is I think the hardest part also that I've had to like deal with. Is like, all right, when I talk about this, I don't just mean like we're gonna look for those 6-packs or like look for this like chiseled everything. Although if you want to do that, you can. But keep in mind that that's also going to, the higher specific you go, the more specific you go, and the more you go into aesthetics, you lose certain aspects, and it's how much you want to like how much you want to give away here and there until you find that right little spot.
Yeah, I think that what you just mentioned is also very important, for me in my job, because, I think it's important to not have like a, ableist kind of perspective of like, okay, you have to have this certain type of body to be able to produce, sound or whatever, but recognizing like within a wide variety of shapes and sizes of bodies, there is function that is important, right? Exactly. And so it's not about having a 6-pack, because honestly, I've worked with singers who have 6-pack abs and they don't have great breath management, right? So they're different things. I do see how that could maybe be a fine line, that especially like with working in the personal training side of things, of like, well, not wanting to, I don't know, cross over that fine line, but yeah.
No, and breath management becomes a huge thing. I don't know. I mean, if you've seen some of the things when it comes to working, and that thing is also happening a lot in the field where we're now looking, as fitness also develops, you're also looking at how your breathing pattern starts to impact your movement during your cross training or whatever you do, and vice versa. How you cross train will impact the way in which you breathe and the way in which you are now able to allow your body to get used to reach those like, full breaths. Because that's why like some of the times like the very first thing you like to do with somebody, just teach them how to like get a full inhale and get a full exhale, so they understand how the pelvic floor drops and moves all the diaphragm, and how they both start to move together. And then that kind of brings me a little bit to that first question that I actually have from somebody that sent me. It's and that kind of goes along with what I'm talking about. It's, you've kind of observed this a little bit more. And my question would be like, have you seen some kind of, in what you've seen, have you seen some kind of pattern within cross training that, and I kind of have an idea, I'm not sure, but that might cause more tension in your upper back, or a certain kind of like, certain kind of movements that create more tension in the upper back when it comes to fitness, when it comes to like exercising?
Okay. I think if I'm understanding the question right, with me not being a fitness professional type thing, like, there's not, I don't like think of specific like exercises or something that I would say, oh, stay away from these. I do, I think that for singers, you do have to be careful with like really heavy weightlifting, just because of the Valsalva maneuver and like how your vocal folds have to really compress pretty tightly just to stabilize your thorax, which can create a little bit more tension. I don't necessarily think that that means that you can't learn to manage that. Like if you're someone who lifts heavy, like I think you can probably learn to manage it. You're probably just going to need to be aware of there's probably going to be some tension created
Right.
around your larynx from it. But I would say, in regards to the upper back, I feel like honestly, most of it that I see at least is tension is actually more um, like over lengthening of muscles. And so
Hmm.
by that, I mean like um, having really rounded shoulders forward and head sticking out and tight, pec muscles, which I think in physical therapy is upper cross syndrome is kind of
Yeah.
how they refer to it. But the back muscles are actually overstretched and weakened. That's probably what I would say I see the most. But people will always talk about, yeah, I have really tight shoulders. Like they talk about their,
Yeah.
yeah, my shoulders get tight a lot, and yeah, my traps hurt a lot, and it's because they're actually lengthened,
Yeah.
right? And sometimes they're shortened, but oftentimes like the rhomboids and like the middle traps and all that stuff are what are lengthened and leading to some of those feelings of tightness up in the
Not
shoulders.
be able
So,
to kind of reach that spot and really like
mhm.
open it up. Yeah.
Right,
Yeah.
yeah,
Yeah. I think that I've kind of, and I kind of can go for that too. And it's, yeah, it's, I mean, that question came in and I was immediately thinking of like upper back a lot of times has to do with because you're spent here, you kind of round yourself a little bit more and
yeah,
not just comes through here where like I like to be able to just get some expansion happening in the back so that if you're able to expand then that allows more space to be able to not contract and create better breathing, which
yeah,
will automatically kind of get you back. But also I think
totally.
is being able to get what happens farther down the chain like you were talking about, right? What's
Right,
going
yeah,
on in your abdominals. A lot of times having like very poor abdominals will ultimately get your more superficial, more layered out
right,
abdominals to kick in, and now you start talking about not being able to maintain yourself in the right posture because your abdominals are not strong enough. Um,
right, yeah, yeah.
but yeah, I think it's very important that you see like the muscle length, and I mean, that's right. Yeah, that's I can completely see how that works, and
Hmm.
then seeing how often it is. I mean, have you kind of seen because you talked to me a little bit about the imbalances that happen down the chain.
Yeah.
Have you seen
Mhm.
what's like the lowest down the chain you've seen something come to?
It's an interesting question. I haven't seen it personally, but I have had, she's a colleague and a friend of mine who has kind of taken an interest in like how the feet affect the
Love that. Yep.
voice, which to me like totally makes sense. But like if you have, I don't know, fallen arches or just some instability in your feet, she said that she's seen with some people she's worked with that, impacts things. But typically what I feel like I notice most is imbalance, like with having like the pelvis tilting forward, like anterior pelvic tilt, and
Mhm.
like weak abdominal muscles, like you were talking about, and not like talking like they don't have a six pack, but it's like their deep core muscles, like their transverse abdominis and the internal obliques and stuff like that, are usually weak.
Right.
And then when you start talking about abdominal breathing patterns, then it's exactly like you said, where they kind of start clenching their rectus abdominis and those more superficial um, abdominal muscles, which isn't what we're going for, and it creates more tension. So it's kind of a different thing to like help people recognize how they're, like you were talking about earlier, like their pelvic floor is involved with breathing, and like low abdominal breathing sensations are different from feeling your six pack engage,
Yeah.
right? It's a very different thing.
Love that. Yeah. Yeah.
Yeah.
No, it's that's crazy. Low. I was wondering actually, how low can that go? How low are we talking? Could it go to the hips? I was thinking the hips, but could it go all the way down to the feet? And that's the part that I was like, I wonder if you've seen anything that has to do down to like how you feel the ground or how like
Right. Well,
because
I think I mean, yeah, I think so. And I think there's a lot of use in doing like grounding strategies and helping people become aware of like, yeah, like you were on the ground and you've got those, those points on your feet where they're making contact with the ground. and then how your legs are kind of stacked over on top of that, and your hips are on top of that, and and kind of
Yeah,
helping them find that stability. Yeah, I definitely think that's a thing.
that's awesome. Yeah, I was actually.
Yeah.
I mean, just looking back and thinking, which is why like hamstrings for me are so pivotal.
Yeah.
Was like
Hmm.
if you spend so much time on heels, a lot of female dancers, you're spending time in heels,
Yeah.
and um, and that kind of also makes me actually wonder a little bit when you're talking about transgender training
Mm.
for the voice and everything, switching their feet, and then I'm talking about maybe some people that are performers also that are also transgender, and then they have to also start getting used to that.
Yeah.
Did you
You
see?
know,
Have you seen anything happen there where like they transition
yeah.
from like flat shoes to like now having to use heels, so they're now having to perform and sing,
Yeah. What's
affect the voice?
interesting, I hadn't thought about it with the transgender population, but I do know that there has been some studies on how heels affect the voice because it's actually my voice teacher who's done a couple of those studies. Her name is Amelia Rollings Bigler. So she's my voice teacher, and she's done studies on how it affects like jaw opening and head position and stuff like that when you are wearing heels. And it does have an effect. And I think it's one of those things where if you can be aware of, oh, this might change how I'm holding my head and how that, you know, affects the position of my larynx. And performers, especially like wearing heels and, costume shoes and all that type of stuff, I think it's important to just at least be aware of, okay, when I'm in heels, how does that change the position of my pelvis and how
Right.
does it change the position of my head? And is it affecting it in a negative way? And if so, can I, kind of reorganize my body a little bit
To mitigate that,
to be
right?
more efficient. Yeah,
Right.
but I haven't thought about it with the transgender population that I've worked with. I guess because usually when I'm working with them, we're sitting, and I don't know. I just don't think about. I haven't thought about it in that context. But yeah, I'm sure it does have some effect. But
That's cool.
yeah,
I love that. I've always been fascinated. Actually, when all this, because the more it becomes just out there and exposed, and just I guess that people can start now acting and seeing just training and all this stuff. And I was also wondering like, how does that start to affect also as a fitness, on the perspective of fitness, and you training somebody, the way I train singers versus the way I train dancers versus the way I train like males and females tend to vary in terms of like
mm,
because certain people need more because of the kind of like demands of the body and demands of. So I was wondering like within the transgender community,
mm,
um, how that starts to play also in their bodies and how that starts to like affect, because it's a lot of change in like you said in the voice.
yeah,
Was that so for
mm,
someone that like me that I'm like basing it off of a binary system?
mm,
Now how do I start to mitigate that
yeah.
into
That's
a system that is no longer binary? So
right.
how do I get into that part of it? So I just thought, I've been thinking about that and wondering, um, I guess later down the line how that starts to affect the more
Yeah,
the more
it's
science comes out of it.
it's a good question, and honestly, I will admit, like, I humbly am I'm still learning a lot about working with that population. And in terms of the changes to their bodies, it really depends on, like if it's a trans female, if they're on hormones or
Yeah,
not. Um, because yeah, there's certainly changes in their bodies. To
yeah,
be honest, I don't really separate it into like, um, so much female versus male or anything with gender. Really, when I'm working with voice in general, I don't separate it too much.
yeah,
Um, and I think that just comes kind of from my background in
yeah.
training and how I learned about voice. But um, yeah, so I don't know. I don't know if that really answers your question or
No,
not.
I mean,
But
I just love learning more about that, and I think
yeah,
I want to read more about that, and hopefully see that become more and more in depth studied. I guess to like
yeah,
how the body starts to also change,
yeah,
so that, I mean, the better that I know that, the better more we know that actually in the physical
yeah,
training world and all that, the more it can become out there, so that other
yeah.
people can just also learn from it and then continue to
Right.
develop it more and
And
more and more.
yep.
And have another question for you that someone sent me. And that someone's like, "How did you help? How? No, what has helped? My bad. What has helped to build your high voice?" Someone sent me this.
What has helped to build my high voice? I would say Probably SOVT or semi-occluded vocal tract exercises probably were a big game changer for me. So like straw phonation, lip trills, things like that. And they're types of exercises that are just kind of based off of the physiology of how our voices work. Um, but also working with a voice teacher has been really helpful. But yeah, I think a lot of times when people are trying to build their high range, their high voice, they tend to just kind of overblow a little bit, like take a really big breath and tank up and then tighten their throat and like push all that breath
Yeah.
against it. And it's a little bit like you don't need quite as much pressure when you get up higher because your vocal folds have to thin out a little bit. Oh, we got a visitor.
Go ahead. Like, no, stay there.
So I'm surprised my dog hasn't tried to make an appearance yet. But yeah, SOVT work like straw phonation, stuff like that, helps you to not over pressurize and stuff like that up in the higher range. So I think that's probably what's helped me most.
I also got asked by the same person to ask you about your larynx tattoo.
Oh, my larynx tattoo. Yeah, I do have a tattoo on my arm here of a larynx. So
That is,
it's like the posterior
yeah,
view from behind, but and then some flowers around it. It's my nerdy speech therapy voice
speech
nerd.
therapy tattoo. I've
Yeah,
never seen anybody with a larynx tattoo, so that's
yeah,
actually a first for me on that one. That's pretty cool. Nice little
yeah.
sectional view of
Uh
that.
huh.
That's neat. When you get that, did you
Thanks.
get that when you were in school
Uh,
or after
It
all
was
this stuff?
actually I had graduated from grad school, and it was right about the time I started at UT Southwestern in Voice Care Center.
So
So,
let me ask you, why of all the things that you've been kind of as you studied this and as you get into, I know you kind of sing on your own a little bit. So what
mhm.
drove you to work with performers and with singers like passionately? You actively seeking that kind of group and audience.
Yeah. So honestly, it was because I had some issues with my voice myself, and I had to go to voice therapy and do all that type of stuff. And I think a lot of the issues that I had with my voice were because of misunderstandings about my body and how my body worked
Mm,
in terms of singing. Um, and I think that's honestly a lot of voice therapists. I mean, I can't speak for all of us, but most voice therapists that got into this field had some sort of issue with their voice. And um, for me, I mean, it really sucked and I hated it. And I wish that, you know, it is what it is. I don't wish to change the past or whatever, but sometimes I kind of think like, I wonder how things would have turned out differently for me if I had understood this or this. And I had a really great voice therapist who really helped me a lot. And I didn't necessarily think right when I finished therapy that I wanted to go into it, but I finished up college and had some changes in my life that changed my plans. And then I was just kind of thinking about it. And I was like, well, I love voice, and I'm kind of a nerd about how voice works, and I
right.
also like people and like helping people. And I just kind of, I don't know, it seemed like a career that was fitting for me, so that's why I
That's
went
neat.
into it. Yeah.
How often do you sing, by the way?
Well, I sing every day, but and I drive my roommate crazy singing every day. But in terms of like actual professional stuff, I'm in a men's chorus here in Dallas. But of course, with COVID, everything's so different right now. So we had a virtual concert for the holidays that I sang in. Um, so yeah, I'm not doing a whole lot of singing right now, just with COVID. But I'm hoping to get more into the performing side of things once things.
Once it kind of come down a little bit,
Yeah, yeah,
eventually. You and
yeah.
this
Eventually.
entire like everybody's waiting for its big return.
Uh-huh.
The Roaring
Yeah.
Twenties begin again.
Right. Yep. Yeah.
So I guess going back now a little bit into this idea of like I guess that you is it laryngeal the laryngeal like I guess when it doesn't work and it's some kind of
Uh-huh.
issue.
Yeah.
What would you I guess say? What would you pinpoint if someone comes to you and said, "Hey, I'm beginning to feel some of these things." Where do you think some of those imbalances,
Um,
closures coming? Usually, like pinpoint, like your rule of thumb, or you're like, let's just get
I
this checklist out of the way, and if it's not those, then we can get a little deeper into that stuff.
Yeah. So do you mean like lifestyle factors or like physically, like what places do I feel for or what?
No, let's go with lifestyle factors, and then if you
Yeah.
want to get more into like where you feel, that could be
Okay.
probably pretty helpful for some people that are watching.
Cool. Yeah. So in terms of lifestyle stuff, I really look at posture and breathing patterns first and
Okay.
foremost. And then I ask I ask them what they do with their day and, I ask them about what they do with their body, like if they work out or anything like that. Um, I ask them about stress levels. I ask for, if there's been any injuries, kind of those things we were
Yeah.
alluding to before. So I really do just kind of go down that checklist. I'll ask about, medical conditions, medications they're taking, because there's some medications
Yeah.
that can, impact your voice. Um, so yeah, I kind of go through that whole thing in my initial evaluation, usually just to try to figure out what are the things occurring in this person's life that may be contributing to this muscle imbalance going on in
Yeah.
their neck. And for some people, it's a kind of a hodgepodge, like just kind of a mixture of a bunch of different things. For some people, it's like one glaringly obvious thing, and once we kind of address that, they're like, "Oh yeah, things are better." But a lot of times, it's kind of like there's stress. They sit all day. They maybe had whiplash a couple of years ago, and they're having some neck injuries, kind of
Got it.
resurface. Just like a few little things that you wouldn't necessarily pinpoint as the cause of their difficulty with their voice, but when you add it all up together, it's like, well, it's having a significant impact on their body. So, yeah.
When you talk about breathing, how do you usually assess that, or how do you go about that one?
Yeah, so I typically assess it by watching and also listening. So I look and see what part of their body tends to move most when they're breathing, like if it's
Mhm.
their clavicles and upper chest when they're inhaling, or if it seems to be more, abdominal rib cage type of breathing. I also listen a lot because if someone has really noisy breathing, that usually, not always, but usually can be a clue that their pharynx is pretty constricted. So if I am working with somebody and they take that type of breath every time before they talk, that we can audibly hear the breath, that usually is an indication that they're taking a really big breath and kind of tightening their pharynx up. um, and I'll also observe, like, do they tend to, like, at rest, do they breathe through their nose or through their mouth when they're talking? I mean, obviously we breathe through kind of our both
Yeah.
our nose and our mouth when
Right.
we're talking, but mouth breathing versus nasal breathing is something I think too that started to become really recognized
Hmm.
as how much it impacts just our overall physical state and whatnot. So yeah, those are the things I look at with breathing, and then of course I ask them, like, do you have any perceived difficulty with
Right.
breathing in this situation? So that's how I go
Yeah, I
about
found
it.
that super like more like very resonating with a lot of the things, and I think I don't know if you've seen or not, but a lot of the things that I tend to pursue with people is mostly right now is being able to differentiate, right, the
Mm-hmm.
how you breathe in certain times, how you breathe when you're
Mm-hmm.
like by yourself versus how you breathe when you're singing, because you're taught a lot of times to sing and breathe through your mouth.
Mm-hmm.
And so that's one way of breathing, but that's not really how functionally, like optimally, you would want to breathe for like your every day. And again, I go back to this
Right.
like which side of the pendulum you want to be on, and
Yeah.
ideally you can be back and forth.
Yeah.
Um, but the effects it has, oh, I heard the
Yeah.
effects it has,
Shaking
yeah,
off.
the effect it has on like on a longer term, like lasting in terms of how you breathe. And I think that's, to me, that seems super super important. And I guess my
Mm-hmm.
question would be, how often or how much benefit do you see it having when you do address breathing, and by default, but when you address breathing, you're also addressing, most of the times, majority of the times actually, you're addressing posture.
Yeah.
Um,
Yeah. Exactly.
so how much benefit do you see that kind of
I
playing?
would say a ton of benefit. And that's another patient population that I work with quite a bit, are people who have a disorder called vocal cord dysfunction or vocal fold dysfunction. It actually has a ton of names: paradoxical vocal fold motion, all these things. But it's actually a
It's dirty,
breathing.
Jacob.
Right? Yeah, I know. But it literally has so many names. It's crazy. But it's a breathing disorder, but it's a movement disorder of the vocal folds, which are the valve for the airway. So people with VCD, their vocal folds will look normal, but when they're breathing, it's usually like they just have dysfunctional breathing patterns, and basically their vocal folds have gotten to where they close when they're trying to breathe in rather than opening.
Mm.
So I work with people a lot on breathing, and I think one of the things that has amazed me most is I've learned throughout my career about the body and breathing and all that stuff is breathing can affect your nervous system, and your nervous system can affect breathing, meaning the way you breathe can contribute to anxiety or contribute to how you feel overall. And you can also use breathing to change how you feel to a degree.
Right.
I think that to me is a really cool thing that I kind of nerd out about. But yeah, a lot of people, when they end up in voice therapy, they usually are pretty stressed. Oftentimes either direct because of the voice disorder itself, or sometimes it's other things going on. And usually their breathing
Right.
not optimal. Even outside of the context of singing or whatever, sometimes it can be impaired just, everyday breathing, like while they're sitting there breathing. And once you address that, I think it helps them to kind of come back into a more calm, like psychological nervous system type of state too. So yeah, I would say I think it has a huge benefit working on breathing.
That's
Yeah.
awesome. That's super. I think that's one of the. I would say, like, for me, for somebody that is obviously not. I mean, I didn't go to speech pathology. I didn't study. I didn't go all this years to study like what you did and what you guys specialize in. But if there's something that I feel like it could help, and just knowing that breathing and posturing, which is something that falls under what I can kind of help with, to hear that
Yeah.
it does help a lot. I mean, that makes me feel a
Yeah.
little easier. It's like, oh, cool. So it is
Yeah.
a good benefit. And then
For sure.
ultimately, like I said, is like, I think for me, it's being able to kind of take what you say and take what other people that study all the different forms of sciences that play part into this, whether it's biomechanics or something not as simple, something as like small. That's what I'm gonna say. As small
Yeah.
as like what happens here, which in a
Yeah.
way could fall under biomech in a different way, like deep, like more intricate level of biomechanics.
Very intricate.
Yeah.
Yeah. Yeah.
Be able to understand that a little bit more, so that to a point I can just say, all right, this is how all these pieces come together, and this is who you like. This is all the data for it, right? And it becomes
right.
The industry becomes so much better for it, and then obviously you guys end up being also like, oh, he said it.
Yeah. Right. Yeah.
You got any questions?
Yeah.
He'll answer right now.
I'll try my best.
I saw somebody here ask a question, and let me see if I can find it real quick.
Okay.
I think Adri. So Adri said, do you have any tips on how to deal with LPR?
Ooh. So yes, I do, but I'm trying to think of like what all I can, I guess, say on here without like because I'm not a doctor. So LPR, laryngopharyngeal reflux, for anybody that doesn't know what that is basically when contents from your stomach, sometimes it's thought to be acidic, and there's other theories that it's not actually acid, but whatever. It comes up from your stomach, from your esophagus, and can spill over into your pharynx and even into your larynx, and can cause a whole lot of irritation, stuff like that. So typically what I counsel people that I'm working with to do is to look at their diet. There's certain things that can be exacerbating for reflux. So like spicy foods, tomato products, caffeine, alcohol, all the fun stuff. Also, paying attention to when you eat, like if you eat and then you immediately lay down, that can be an issue. Paying attention to how much you eat in one setting. So like if you're kind of overeating and stuffing yourself, that can cause some issues. But a lot of times, surprisingly, it comes back to breathing. So what I've found, and there's some research that I'm not gonna be able to cite, but some things that I've been reading about how if your breathing pattern is more optimal, like more abdominally based, it can help keep the sphincter in place that closes, to keep stuff from coming up in the first place. But
Yeah.
um, there's also some medications that doctors can prescribe that can be helpful. And there are some, I guess, supplements that are out on the market that you could also talk to a doctor about that are less, have less side effects than like PPIs and stuff like that. But I think for LPR, it really is learning to manage your body and like how your body responds to food, and to stress and stuff like that. But yeah, I think that's probably all I feel like I should say in
I mean,
terms of,
huge
not
points.
being a doctor.
It keeps coming back all this to like your posture, your stress, your breathing, your eating, and really understanding your body.
Yeah, I mean
If you can do all those 5 things,
yeah,
you're really gonna be one step ahead,
yeah.
which is
I mean
awesome to hear actually. That's
yeah, because
great.
I mean, it's your voice is, we say like your voice is an instrument, but really it's your body is your instrument, and your body produces your voice, right? So, taking care of your body and your heart and your mind, soul, all of that, I think is ultimately what is going to help you have, the best voice possible. Because, us as humans, you can't separate the physical from the mental from the emotional,
Yeah,
really, because it all impacts everything. So
I love that.
yeah,
Jacob, this seems
yeah,
so fun. I mean, those are all the questions I have. I could probably ask you a lot of them, but I know we only have a time limit here on this of like an hour. And I don't
yeah,
want to like get close to that or get you started with something that's gonna take a lot more because then
right.
I just
Yeah.
it's been so cool listening to you talk about this. I mean, I don't think we
Yeah,
nerded
thanks for
out
having
as
me.
badly as to a point that like I think people can't follow or anything like that.
Right,
Love
yeah.
hearing your perspective on
Hopefully not.
posture, on stress, on breathing, on the effects the body has. I think it's super cool to hear from somebody that's in the science of this little tiny tool that does so much.
Right. It does so much,
But to
yeah.
hear how it is all interconnected is what kind of drives me crazy, and I like love hearing
Yeah.
about how much more that kind of the systems within systems within systems that happen that they all kind of
Hmm.
pull together, and I think it's great to hear your perspective, especially you that you're involved with so many performers,
Yeah.
and then also you sing yourself, so you are able to also come from
Hmm.
a personal place to it, an emotional place
Yeah.
to it, and also from a professional side. So I think all of those together
Yeah.
kind of play into it. Um, I guess, do you have something you want to like shout to people, like where they can find you if they have anything like any questions? You work at, I mean, I guess you can tell them where you
Sure.
work and all that stuff.
Yeah, yeah. So I work at UT Southwestern, Clinical Center for Voice Care, and our social media, we have a Facebook account. I think it's just UT Southwestern Voice Center. And then we have an Instagram account, which is at Texas Voice. So you can find us there. And yeah, I mean, if anybody has any questions you want to ask me, you can send me a DM or whatever, and I'd be happy to try to answer. But yeah, either the Facebook page or the, Instagram, we've
At
got
Texas
some
Voice.
different articles and whatnot on there. Yeah,
That's awesome. So I'll put that on the notes, Texas Voice, and I'll put yours on the notes also, so that people can reach
cool,
you. And then I guess,
cool.
where can they find you singing in this beautiful choir and hearing your voice also?
Oh. um, I have stuff on my Instagram and my Facebook page, but my accounts are private. So I think there's probably some stuff on YouTube, but it's probably embarrassing and terrible. But I also do have, I just remember this, I do have a little EP on Spotify and iTunes and stuff that I recorded like 5 years ago. So if you search my name, you'd find that too.
Awesome. A little EP on Spotify.
Yeah,
Yeah, there we go.
yeah,
That's good.
yeah.
I love that. Good. I'll add that
Yeah.
in. That
Little plug
immediately
there, yeah.
watch me immediately close this and go immediately. Let's listen to this. Well, it's awesome, Jacob. It
Right.
was so cool talking to you, man. I
Yeah.
know
You
what
too,
time is it over
Jonathan.
there? Like 6:20. You still got time to go have dinner and enjoy the rest.
6:20. Yeah.
Well,
Mm-hmm.
cool. Well, have a
Yeah.
beautiful rest of your day.
All right. Thanks,
I'm gonna
Jonathan. You
go
too.
here and just pay attention to her because she's now getting a little antsy.
Right. Yeah.
It was
Okay,
so
cool.
nice meeting you again, Jacob, and thank you
You
again so
too.
much I
Of
will
course. Thanks for
message
having
you
me.
later to say hi and all that stuff and keep up with
Okay,
you.
sounds good.
All right.
Awesome.
Bye,
Take
Jacob.
care.
Have a good night.
You too.